guys.
Hi guys.
So every surgery journey starts with that first consultation, which is such an exciting step. And for me, meeting my surgeon for the first time was just so empowering, although it did feel a little bit daunting at times. But it is your chance to ask all those burning questions and discuss any worries. Now, I came out feeling so excited and had all the information I needed. So today, me and Charlotte are going to be going through what happens at your consultation and why it's such an important step.
Hi everyone. So at your consultation, you'll meet with one of Pall Mall's qualified surgeons and a patient coordinator who will discuss your goals and expectations, take measurements of your chest and breast tissue, feel for any lumps and bumps, talk through implant options, sizes and placement, review your medical history and lifestyle factors, and discuss a plan for your surgery. So when you go for your consultation, your surgeon will take time to really understand your goals.
Definitely, and I'd say things to think about beforehand would be, do you want a more natural look, something fuller and rounder, or are you looking to restore some volume that you might have lost after pregnancy? These are conversations that are really important, and they want to know what is driving your decision to have breast surgery. Now, I remember being really nervous when I walked in and I had all these thoughts spiralling around in my head, and even things like, what if I ask the wrong question or forget to ask the important ones?
That is completely normal. We do get that a lot.
But I can honestly say that my surgeon definitely made me feel completely at ease. There was no rush or pressure, and I realised very quickly that there's no such thing as a silly question, trust me.
Exactly, and that's what we want all our patients to feel like. So after discussing your goals, your surgeon will do a physical assessment. They'll take measurements of your chest, your breast tissue, your skin and your nipple position. So this helps guide implant size and placement, because what looks amazing on one person might not suit another. At this point, your surgeon may also take some confidential photos to help plan your surgery. Some surgeons might show before and after photos of other patients with a similar body type to give you a realistic idea of outcomes.
Trust me, it's not as scary as it may seem, and you can take someone in with you. I took my mum in, and if not, you can always have a chaperone present with your surgeon, and this will always help make you feel more at ease.
Yeah, you can definitely bring someone with you if that helps. You'll then talk through implant choices. So at Pall Mall, we use Motiva or Mentor implants, which are both FDA approved, CE marked and covered by a 10-year warranty against rupture or capsular contracture. We only use the best. We do also offer B-Lite implants, which are up to 30% lighter. Your surgeon will explain sizes, profiles and shapes, round versus teardrop, and what each might look like on you.
Okay, so I found this part absolutely fascinating, to be honest. They even show you what they call sizes. Now, if you don't know what this is implants that you can pop inside a sports bra to get a feel of different sizes and how they'll look on you. And this was the first time I could actually picture what I might look like afterwards. So don't forget to take pictures at this stage. In fact, your surgeon will most likely encourage it, and this is really helpful over the next couple of days while you're trying to make a decision to look back and remember what they feel and look like.
Taking pictures is definitely a great tip. So next up after that, your surgeon will then cover your medical history and lifestyle. So they'll ask questions like whether you smoke, medications that you're on, any previous surgeries. Sometimes additional health checks are recommended just to make sure that you are fit for general anaesthetic. And of course, they will then talk through the risks and recovery. So this is an honest, open conversation about what the surgery involves, what to expect and what's right for you.
So this part's all with your surgeon then, isn't it?
Yeah, so this part is all done with your surgeon. You'll then meet with your coordinator who will go through things with you like pricing, finance options, potential surgery dates that are available, and they will give you a full breakdown of everything that's included in the pricing and talk you through any questions that you might have. So they will also then send all of that information to you via email to look over whilst you're making your decision.
That's amazing, and honestly, I never felt pressured at all. It was just like having a bit of a conversation with a friend. And for me, I realised that the consultation wasn't just about the results that I wanted, but it was about having a full understanding of the whole process. And I left knowing exactly what was involved every step of the way, and it gave me a real peace of mind.
Yeah, you're absolutely right. So your consultation is a safe, supportive space where you can discuss your goals, have measurements taken, explore implant options, review your health, and you can ask as many questions as you need to. It's about giving you the knowledge to make an informed decision. So it's good to know as well that our consultations are complimentary. If you need more than one, whether that's with the same surgeon or a different surgeon, that's absolutely fine. It's important that you feel relaxed and that all your questions have been answered.
Amazing. So I guess my top tips then would be going forward is to go prepared, bring some photos of what looks and sizes that you might want, and write down any questions that you've got, even if you think they're silly. It will help so much. Now don't forget, we've got more videos where we go into detail about implants themselves, brands and sizes, and even shapes. We'll see you all there.